FM 104, KUOO Campus Radio, Becky Thorson. Time for Becky's Business Beat. And joining me today, Brenda Muller, Outreach Clinic Director with Windom Area Health. Hi, Brenda.
Hi.
What are you going to talk about today?
Well, today I'd like to talk about our ostomy clinics. According to the United Ostomy Associations of America, Inc., there are 725,000 to 1 million people in the U.S. living with an ostomy.
So, what is an ostomy?
Well, an ostomy is a life-saving surgical procedure that allows bodily waste to pass through an opening in the body called a stoma into a prosthetic pouch or an ostomy bag, normally on the outside of the abdomen. The ostomy either bypasses or replaces a damaged or non-functioning organ and is necessary if a person has to have a piece or all of their colon removed, for example. You maybe know someone who has to wear a bag on their abdomen because they have to have part of their colon removed.
Yeah, I think a lot of people probably know someone that has that. And it sounds serious. What would be the reason someone would need an ostomy?
An ostomy may be necessary for a variety of reasons. This may be due to an illness or problem with the person's digestive system, like inflammatory bowel disease or cancer. An ostomy may also be necessary due to birth defects and in cases of severe abdominal trauma from an accident or other injury, to name a few.
Now, I've heard of a colostomy. It sounds like there are other types of ostomies.
Yes, colostomies seem to be the most well-known. The most common are colostomies, ileostomies, and urostomies. So a colostomy is when a person has a surgical operation, like I said, to bypass or remove a diseased or damaged colon. An ileostomy is when the ostomy is done to the lowest part of the small intestine. And a urostomy redirects urine away from the bladder.
So an ostomy clinic is a clinic that specializes in the various types of ostomies then?
Yep, that's correct. Ostomy clinics are a specialized service for those people with an ostomy or in need of an ostomy.
What sort of specialized training does a provider need to care for ostomies?
Here at Windom Area Health, Naomi Bach and Liz Coleman are nurse practitioners who have special training in wound ostomy care. So if you see the CWON initials behind their name, that stands for Certified Wound Ostomy Nurse.
What are the benefits of seeing a provider with this specialized training as compared to a provider without it?
Needing an ostomy can be a life-changing experience. But studies have shown that patients who receive teaching prior to and after surgery from a practitioner who is specially trained in ostomy care have a better transition and long-term outcomes.
How else do your ostomy clinics help?
So here at Windom Area Health Ostomy Clinics, patients can be seen at any stage in their ostomy journey, from pre-op counseling and teaching before the surgery to post-op follow-up care and long-term management. So preoperatively, Naomi and Liz can work with the surgeon to figure out the best location and ways to care for the stoma. They can explore many aspects, including what to expect with the surgery, the appearance and function of the stoma, and how to use the pouch and how to obtain the supplies. And then postoperatively, the providers can ensure appropriate healing of a new ostomy and help patients learn to return to normal diet and activity. And postoperative teaching helps patients regain their independence and manage their stoma in everyday life, which helps with the transition back to work with their new normal.
What is the long-term care for patients with an ostomy then?
The long-term care for patients with an ostomy might include annual visits, troubleshooting, pouch refitting, things like that. The body changes over time and the stoma changes with it. So it's good to have the stoma checked by a trained practitioner once a year and is needed for issues. It's important to prevent the skin issues around the stoma and address any problems with the pouch leaking, and maybe even monitor for the development of hernias.
Well, that sounds like a really great clinic to have.
Yes, an ostomy can often be very overwhelming for patients and families. Ostomy surgery can be needed at any age. It does not lower a person's life expectancy, but it is the start of a new normal life for many people. So we're happy to be here to help make our patients as comfortable and confident as possible in managing their ostomy so that they can have the best quality of life possible. So don't let your ostomy slow you down from doing the things that you love.
How would someone go about setting up an appointment if needed?
So anyone with an ostomy or in need of an ostomy may call Windom Area Health at 507-831-2400 to set up an appointment, or for more information, they can check out our website at windomareahealth.org. And as always, be sure to like us on Facebook.
Okay, so 507-831-2400 and lots of info also at windomareahealth.org. Thanks so much for all that great information, Brenda.
Yes, no problem, and thanks for having me.
There's Brenda Muller, Outreach Clinic Director with Windom Area Health. Visit windomareahealth.org. That's Becky's Business Beat on Campus Radio, KUOO.